Hi, we are now 6 weeks out post prostate removal, and I wanted to give you a quick update on where I'm at and also um, share with you some information I learned at my 6 week appointment with my physician yesterday. So, first and probably most importantly, if you're going through your own prostate cancer journey, what you'll be most concerned about in the 6 week period is where does your PSA level fall? Um, you'll remember that PSA is a protein that can be tested within your blood that is an indicator for your risk for prostate cancer. So, my PSA level had reached 13. And once the prostate is removed, naturally your PSA will go down. The question is, how, how far down will that PSA level reach, and what is kind of a normal range? So, my results came back yesterday at 0.1, which sounds really good. But the doctor wants to see them at what they call undetectable levels. And so the best case is that you would be at 0.04 or below. So I'm not quite where I had hoped I would be, but still no reason for alarm at this point. Um, there's a few reasons why my PSA level could be higher than the 0.04 undetectable level, and we kind of talked through those, and I want to share that information with you. So first, it could be that the protein that was in my blood is there's still some remnants of that, right? Again, I was a 13 prior to surgery, so it may just take more time in order for my PSA to reach the undetectable level. The other possibility is that when they remove the prostate, there are still small fragments of the prostate that remain in my body. Um, so that's common, and what we would expect if that is the case is that my PSA level would stay consistent. If it's in fact that the PSA is kind of working its way out of my body, we would expect the PSA to go down. Both are great scenarios, and time will tell. The worst case scenario, and one that I am refusing to believe at this point that will be my particular case, is that the cancer breached the prostate, and that's why my PSA is not at an undetectable level. In that case, we would expect the PSA level to go up. Um, for for my treatment and follow-up, the doctor is going to request a PSA screening every 3 months. So I'll know in 3 months' time whether I've dropped, stayed the same, or gone up. So nothing really to be alarmed with at this point. It's just something that we'll have to monitor really, really closely. Now, in 3 months, we'll just see kind of what's happening and have a discussion. But it probably won't be until the 6 month mark where I've had 3 PSA tests that will make a determination whether or not further treatment is needed. And the only reason why we would be discussing that is if we see that 0.01 PSA level continue to rise, and we would have 2 additional tests to validate that it is rising. Most likely, the treatment plan would be radiation. So, not really putting too much thought or energy into that right now, but it is something that you should be aware of, and something that you should know ahead of time that you'll be tracking and monitoring. The good thing is the test is really simple. It's a quick blood draw and follow up with your physician to track that PSA post surgery. Other physical updates, the incontinence is still there, but it is becoming less and less of an issue. I have really good days where I feel like there's no leakage at all, and then I have days where I can be moving around or maybe even mentally stressed, and those things can cause leakage. But overall, we are seeing improvements. The doctor made a really good point yesterday that recovery is not linear. So it's not improvements every single day. In terms of erectile dysfunction, that is still there as well. Unfortunately, I'm taking the 5 milligrams of Cialis to increase blood flow as part of the treatment, and then I have a 20 milligram dose that is supposed to be on demand. I've tried it 3 times now, with 1 week in between each trial, and have seen really no difference in performance with or without the 20 milligrams. One thing to note is that there are other medications out on the market, and our bodies do respond to different medications in different ways. So I will be trying Viagra just to see if my body responds to it differently than it has the Cialis. But if not, still no reason to be concerned. It can take 6 months, even a year, for the nerves and blood vessels to completely heal. So it's just something to continue working at. Other than that, physically, I'm doing much better. I'm still running, run a couple of 5-milers, 3 or 4 now actually. And this coming weekend, I'll be running the CAP 10K here in Austin, which is a 10K, obviously, just over 6 miles. So I'm excited about that. I've also started CrossFit again, very lightweight, very low impact. I had a conversation with the trainers ahead of time who are aware of my situation, and will be kind of modifying my workout based on where I'm at physically. But I'm happy to be back in the gym and at least working at it, right? So that's the latest status. I'll be glad to share kind of the results of PSA in 3 months' time, maybe with a couple of other updates as improvements are made. As always, feel free to leave any questions or comments for me, and I'll get back to you. Thanks.